കാസർഗോഡ് പ്രേക്ഷകർക്ക് മെഡിട്രാക്കിൻ്റെ മറ്റൊരു എപ്പിസോഡിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്ക് ഡിസ്കസ് ചെയ്യാൻ പോകുന്ന വിഷയം ന്യൂക്ലിയർ മെഡിസിനെ കുറിച്ചാണ്. എന്താണ് ന്യൂക്ലിയർ മെഡിസിൻ? അതൊരു ഡയഗ്നോസിസ് മെത്തേഡിന് വേണ്ടി മാത്രമാണോ ഉപയോഗിക്കുന്നത്, അതല്ല അതൊരു തെറാപ്പിക്ക് അല്ലെങ്കിൽ ചികിത്സാ രീതിയിലും ഉപയോഗിക്കുന്നുണ്ടോ? ഈ വിഷയത്തെക്കുറിച്ചാണ് മെഡിട്രാക്ക് ചർച്ച ചെയ്യുന്നത്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റൽ ആൻഡ് റിസർച്ച് സെൻറ്ററിലെ ന്യൂക്ലിയർ മെഡിസിൻ ഡിപ്പാർട്ട്മെൻറ്റിലെ Dr. Radha Mohan. Sir, welcome.
Thank you.
Sir, today we are going to discussing about intro part already explained regarding nuclear medicine. See, in hospital, especially super specialty hospital, we have seen that radiology department, nuclear medicine department, PET scan. See, so many advanced departments are there. See, nuclear medicine. What is nuclear medicine?
See, nuclear medicine is called like that because it utilizes the radiation coming from the nucleus of the cell or atom. That is why it is called nuclear medicine. Basically, the gamma rays that come when nucleus is disturbed. Those rays we are using in nuclear medicine. That is why it is called nuclear medicine.
Okay, see, our viewers have so many doubts regarding this department. Even at X-ray or CT scan, they may have some knowledge or some idea regarding that one. Regarding nuclear medicine, see, what are the services given from nuclear medicine department?
See, nuclear medicine is not a new specialty. It is there since almost since many years. But awareness is much limited. That is why people do not know the uses of nuclear medicine, especially in nuclear medicine in patient treatment. It started with thyroidology. In thyroidology, it has a very good role because thyroid gland concentrates iodine. It is involved in metabolism of iodine. So instead of normal iodine, stable iodine, we use radioactive iodine. So that way we can detect function of thyroid gland. How is functioning, etc. we can detect. That is one area where nuclear medicine is very useful. Other areas are, suppose patient is having chest pain. The basic test in such conditions is, if you are suspecting ischemia of heart, the first test that should be done is a treadmill chest test with ECG. Suppose ECG is equivocal, in that case this is a very useful test. We inject a radio pharmaceutical called thallium or technetium MIBI or technetium tetraphosphine. When we inject and we make the patient to undergo maximum physical exercise on a treadmill. During peak exercise, we inject the isotope. So this isotope, this radio pharmaceutical I should say, will go and is taken up by myocyte. Which that part of the heart or left ventricle which has less blood supply will concentrate less isotope. So when you afterwards when we make a scan of heart, the area which has less circulation will show less uptake compared to the heart which has normal circulation. That way we can detect coronary ischemias, what you call it.
See, doctor, see how the patients are, see how they are coming in nuclear medicine for see why I am asking this one means without the advice or prescription of a doctor. See, for a CT scan, an MRI, an X-ray, doctors are for that you should take this kind of diagnosis. Like that also, which department is more sending patient to this nuclear medicine department?
See, nuclear medicine involves one is endocrinology, cardiology, oncology, then gastroenterology, nephrology and urology.
Almost all the departments.
Almost all departments can send patients. It helps in almost all departments workup.
Endocrinology, sir mentioned that endocrinology. How it works? Endocrinology. What is the use of this?
See, that's what endocrinology has. Actually, nuclear medicine started with thyroidology or endocrinology. Thyroidology. See, previously there was no facility to measure thyroid hormones. So at that time, people were measuring thyrotoxicosis or hypothyroidism with our radioiodine methods only. Now what happens, hormone estimation levels are available, so people depend more on those hormone estimations to diagnose hypothyroidism or hyperthyroidism.
Okay.
Still in doubtful cases, this is still useful
Okay.
to diagnose hypo and hypothyroidism. For example, hypothyroidism use is not that much, but hyperthyroidism, whether it's due to actual thyrotoxicosis
Okay.
or thyroiditis, this is a very useful study.
Okay. See, actually, this nuclear medicine, see how it works in human bodies, how this medicine works. So, see, for example,
Okay, we take a radioactive isotope called technetium-99m. That is the basic isotope we use.
okay,
Then we select a compound or molecule which is taken up by the organ which we want to study.
okay,
So we tag both of them
okay,
and then we inject it through a blood vessel.
okay,
Then that compound goes to that organ. Along with that compound, radioactive material also goes to that organ. So how it is taken up by that organ and how it is handled by that organ, that gives us information about the functional status of the organ. If thyroid is overworking, there will be more uptake of the pharmaceutical. If function is less, uptake will be less.
okay,
So that's why we can, same thing in way, any organ, heart also, same thing. We inject a radiopharmaceutical with a compound called sestamib or tetraphosphine. So when sestamib is taken up by myocyte means cardiac cell, radiation also goes with that. Normal areas will take up normal uptake.
okay,
Those areas which show less perfusion, less blood supply, they take up less isotope. So the difference will tell us that this organ is having less blood supply.
Sir, just previously just mentioned that regarding the functions of organs, for example, heart. Okay, see for functions of heart, and we have some other tests also, TMT, echo test, so many other tests also there. Then scanning also there. Then why should the patient go for this nuclear medicine department?
See, TMT is a good basic test for coronary heart problems. It's a basic test. I don't deny that.
Okay.
But sometimes it is inconclusive.
Okay.
Sometimes the doctor cannot say with certainty that there is cardiac problem.
Okay.
In such conditions, definitely our studies are useful. Echocardiogram also is a basic test nowadays, I agree. But sometimes for coronary ischemia, echocardiogram is basically to know cardiac valves and pumping action of heart.
Okay.
Whereas our study is basically to know blood circulation to heart and
Okay.
pumping action of heart.
Okay.
So whenever the doctor is in doubt after these basic tests, then he has to ask for our
So after
test.
done this all basic test, still any doctors
Doubt,
have any
then
doubt,
it's
then
better
only
to
they
do
will
this.
send to
Okay.
nuclear medicine.
Not as a primary modality, not as a
Okay.
primary test.
Okay.
After other tests are inconclusive or they want to have extra information,
Okay.
then these tests are useful.
Okay.
For example, cardiac pumping we will also measure,
Okay.
but our values are comparatively more accurate compared to echocardiogram.
Okay.
See, what you call cardiac ejection fraction, how much heart is pumping with each beat, that value what we get is more accurate compared to echocardiogram.
Okay. See, sir, from your experience, sir, which department, I mean cardiology, oncology, so many other departments, which department is more depending on this one, nuclear medicine department?
First I should say endocrinology, thyroid problems.
Okay.
Then comes oncology.
Oncology.
These two are main for us.
Okay. See,
Then nephrology,
Yeah.
urology. That
Urology,
is urology is very important. Area where nuclear medicine is very useful. In fact, after thyroidology, urology and nephrology, they send us maximum patients because see,
in urology, what kind of functions of
See,
what you are this one
see,
sir, diagnosis is there?
basically for diagnosis here,
Yeah.
a ultrasound will show kidneys showing enlarged pelvis.
Okay.
So this enlarged pelvis can be due to obstruction or due to weak muscle tone. So ultrasound cannot differentiate that. If it is a weak pelvic muscle tone, it can be managed without operation. If it is with obstruction,
Okay.
surgery has to be done. So to differentiate that, we do a scan using renogram. The compound we use is DTPA, those things I will not go into detail. So when we inject that isotope, this is taken up by the kidneys, either kidneys. Okay. So how much is taken up and how it is excreted after taking up, this will give us idea about kidney function. How much medicine kidney is trapping. If kidney is functioning normally, it should trap normally. Suppose if kidney function is subnormal, uptake will be less in the kidneys. So that we can calculate, what we call GFR, or we call tubular secretion. Those things we can actually calculate. So this functional, and then if there is any obstruction, we give a diuretic. Diuretic means which forces more urine formation. So after giving this diuretic, if there is a clearance of the urine, that means there is no obstruction.
See sir, before coming to this nuclear medicine department, this patient have any preparation for that one?
No extra preparation, they can have food and come. In fact, they should have good water intake before coming. Some studies we tell them not to have 4 hours fasting, especially heart studies, liver studies, abdominal studies, those things we tell them 4 hours fasting. All other studies they can come as it is. And it is very safe also. We are doing scans from a newborn child to very old people. With badly damaged, if kidneys are badly damaged, they cannot do many procedures. Because we can do safely, we can do procedures.
No sir, here is some fear factor also. See, for example, any regarding nuclear medicine, that word itself, some fear factor will get patient and bystanders. Is it?
Our radiation exposure to the patient is much less than an ordinary X-ray. This fact everybody should remember. There is radiation, but the radiation exposure is much less than a simple X-ray. X-ray will give more radiation than a nuclear medicine procedure. And only thing we tell, if patient is pregnant, we generally don't avoid. We avoid it unless it's very essential. And patient is breastfeeding the child, we will tell them not to breastfeed for 1 day. If it is a technician, if it is iodine, we use them. Tell them not to breastfeed for a few more weeks.
So after done the diagnosis, the patient should be here. How long it will take time to stay here?
Soon after the procedure, they can go home.
No issue, no other issues. They can
only we tell them to drink more water. So that if they drink more water, there will be more urine. Through urine, this radiation is drained out.
Sir told during the procedure, this one injecting radioactive like that. Sir, you see, regarding nuclear medicine, we know that it is that will spread, or when the radiation is to other people or other bystanders, any other thing is, why should
there is some radiation to bystanders also. But as time goes on, technician.
How long it will take, sir? For example, after the procedure, suppose it is 1 hour procedure, immediately after 1 hour they can left from the room, or anywhere they can go.
See, radiation is there, but it's very minimal. So it won't harm the people. If they are young people, infants, and young children, we will tell them at least for 1 day, don't go near them. 1 day. And that I didn't miss a few more days. Because as hours pass by, radiation level will come down. We tell them to drink more water. So urine radiation will go out. And as such also, every 6 hours it becomes half of its previous value.
Like that it is reduced,
reduced both on its own plus through urine.
No, sir, my doubt is this one. Till that 6 hours, the patient should be here, or they can.
No, they can go home. No need at all. We only tell them don't go near the children at least for
certain time.
That too, after 6 hours it will be still less. So we tell them to can go home immediately, no problem.
Sir, preparation regarding patient, I asked. Preparation regarding this department, from where did get the medicine, and then how
medicine is supplied by atomic energy, by BRIT. There is a government organization called BRIT, Board of Radiation Isotopes and Technology. They supply, and sometimes we import them also from outside.
Okay, see this one, sir, how it is bringing, sir, because this is a nuclear medicine department.
There are strict
Yeah, yeah, there is a guideline for government.
Yeah,
sir.
that's
How,
what
how it is getting?
there are strict guidelines.
Yeah.
How to handle, how to pack them, how to. They have to come by airplane only, or they should come by own vehicle, not through public transport.
Oh, okay.
All the isotopes come to us either through aeroplane or to their own transport, not through public transport.
Okay.
Aeroplanes they can come because only 2 hours, 3 hours it will take.
Yeah.
Not much time. Otherwise, by they can buses etc. they cannot send it. Train etc. They have to.
It will take. See, more time means what it will affect.
That's why they have to come their own transport. Their own transport. They have to. Company will have to send to us on their own transport.
No, sir. This medicine, after getting this medicine, certain periods are there. Within the short term period, we should use it. Okay.
Because power it undergoes later to decay. So its power becomes less and less as they specify.
Then how long it will here, sir?
Again, it depends. It depends on the isotope we use. And what the technician we use, this patent comes to us.
Okay.
That patent can we use for 1 week.
1 week.
From
till
that
1 week.
patent to the data is extracted daily. But if today if I get 100, tomorrow I will get 90. Next day I will get 81. Like that it goes on becoming less and less.
Okay. Then
So,
how long? Then how?
So that's why later, first day we can take more patients, second day less, third day less. Like that it goes on becoming less and less.
Okay. Then how to give the slot for, say, for example, patients are supposed to more than 10 or 15
See, we
patients.
know how
and
much
then
radioactivity we get
yes.
on each day. This already you can calculate.
Depends on
accordingly,
you should
we
give
give
that.
appointments. Accordingly, we give appointments.
Okay, okay. See, so far we have discussed about the diagnosis part of this one. Sir.
Diagnosis also.
Okay,
see, this is very, as I said.
Any therapy, that means
No,
in a treatment part.
diagnosis is not at all. I see.
Yeah.
For example, in diagnosis also, heart I said, thyroid I said, kidneys are very useful in kidneys. Kidney infections, we do a DMSS scan. That that tells function of kidney, and any focal area of kidney is damaged. That information is given. This is not given by other means, other tests.
Any
so
scanning, any other
DMSS scan we call it.
Okay.
So dimercaptosuccinic acid scan that shows any focal damage to the kidney, that we can detect that.
Okay.
And we can do it safely in newborns also.
Okay.
We have done every day. Newborn babies also we do scans.
Yeah, maybe viewers have some doubts, sir. So, regarding newborn babies, sir. Even this one nuclear
We are
medicine,
doing
then
it because
what is
their
that
kidneys
dose?
enlarged. Kidneys enlarged. They want to rule out obstruction to the kidneys. We are doing the study. If you give like that, kidney gets damaged.
Yes,
So we have to find out what the obstruction, this obstruction or not. For that we are doing in newborns also scans.
Then regarding this oncology department,
Oncology
there it is
basically
more.
one thing is thyroid cancers.
Okay.
After in thyroid cancers, firstly they do operation.
Okay.
After operation is done, they are sent to us
Okay.
to know any thyroid tissue is left behind after surgery. We do iodine scan from. It's not technician. Then we do iodine.
Okay.
So anything is left behind, that person we have to treat by giving high dose of radiation orally.
Okay.
That patient we have to admit for 1 or 2, 3 days, depending on the radiation level in the body.
Okay.
So their oncology patients, many come to us after surgery to do a scan and then to further treat it.
Okay.
We call high dose therapy.
Okay. The treatment, the therapy part also here, sir. This one.
Yeah, we have.
Yeah. Only in oncology, this one.
Oncology
Okay.
and also thyroidoscosis. In thyroidoscosis,
Thyroid and endocrinology, but that means thyroid and oncology, there also we will
Definitely.
contribute this one. Treatment part.
Thyroidoscosis, what happens, thyroid is over functioning.
Okay.
It will have effect on the body. Body becomes weak, lean, heart
Yeah.
becomes irregular, bones become weak. In such conditions, we give a iodine treatment
Okay.
and the thyroid becomes normal. And it may become subnormal, but we can still treat it. A very safe way of treating thyroidoscosis.
Okay. Sir, see, sir, one more doubt. Doubt is this one, sir. Sir, before that we are just checking our sugar and BP, and before, if we have any disease, sir, we are just checking our this one cholesterol level, then sugar level, everything. Okay. Like that, one person needed to instead of scanning a person's body, any chance to get this one onco-related cases?
See, right now we don't have in our setup those
Whole
facilities.
body,
In
no,
future
no.
it may come,
Okay.
but I cannot say. But spread of cancer we can detect. Spread of cancer we can detect.
Okay.
But cancer is here. They are not. That is not.
Even your nuclear medicine
No,
department
PET
also can.
scans to some extent they may. PET
Yeah.
scans are there for that.
Yes, yeah.
Not routine nuclear scan.
So far not this one. Maybe we can in future
The
we can expect.
bone scans are very useful in oncology. If
Okay.
there is a spread of cancer, bone scans will detect spread of cancer much earlier compared to X-rays, etc.
Okay.
And if there is any problem in the bone, for example, arthritis, small fractures, those things can be missed in routine X-rays. Those things can be detected much earlier in nuclear scans. So in orthopedics also it has a good role.
Okay.
There is some non-union of bones after fracture that can be detected. What you call avascular necrosis. After trauma, blood supply to the bone is less. That can be detected. So many applications are there in orthopedics.
So many applications, so many for diagnosis and therapy part also in nuclear medicine.
Definitely.
There is a prominent part of therapy also in nuclear medicine
Especially
department.
thyroid.
Yeah, thyroid and
Oncology
related cases.
especially.
Yeah.
Oncology basically prostate. So
Yeah.
suppose there is prostate cancer has spread to bones,
Yeah.
multiple bones.
Yes.
So they are not, they have become resistant to routine treatment, hormonal treatment.
Okay.
Such conditions to reduce pain, we can inject isotope and reduce the pain of the patient.
Okay, that part also we can do.
we can do.
Okay. See, regarding nuclear medicine department, almost all the topics we are covered, so not all. Anyhow, we are
Some
of the
at brain I want to brain also dementias.
Yeah.
There nuclear medicine is very useful.
yes.
Dementia means what you call Alzheimer's, etc. There nuclear scans are very useful. And then movement disorders like Parkinsonism. There also nuclear scans are very. They can detect disease much earlier.
Only detection means or in therapy? No,
No,
only
there is detection. I am talking about detection. Brain
okay.
also.
A diagnosis part is more important there.
Especially Parkinsonism, dementias, epilepsy, fits.
Okay.
So their nuclear medicine is very useful to diagnose them.
Diagnosis, that part it is more useful.
Very useful.
Okay. So shall we wind up today's episode?
Okay,
Almost all this regarding nuclear medicine. What are the prominent diagnoses we are doing in
So
nuclear
what
medicine?
I want to highlight is
Yeah.
is very safe.
Okay. No need
No
of
need of
fear
any
factor.
fear.
No need of fear factor.
Okay. If it is useful to the patient, it should be done.
Yeah.
That's all.
Okay.
No need to avoid nuclear medicine just because of radiation. Patient's benefit is more important.
Yeah. We'll get a more clarity or clarity result. and diagnosis
Patient
and-
can undergo repeated X-rays and CT scans. This more safely this can be done.
Okay. So no need of no need for any fear factor
No
there.
fear.
Directly we can go through this diagnosis.
And cost wise also it is not very expensive. Just like any other scan.
Okay.
MRI, CT scan, something like that.
We will get a accurate result also. After
Result,
that.
yes,
Yeah.
yes.
Okay.
This is our gamma camera
Okay.
which has two detectors.
Okay.
Patient is injected before or here, depending on the study we want to perform. After intravenous injection, patient will be under the camera and it will detect the radiation coming from the organ that we want to study. And the later that image is processed through a computer, and that will give us functional information and functional imaging of the organ we want to study.
After the procedure, when the result will get, sir?
Within 10 to 15 minutes.
A patient will get the result immediately after within the
Some
20.
studies may require more time, but most of the time 10-15 minutes with the report also it will be ready.
Okay. See, sir, just explain that regarding gamma cameras. Mainly it is using for what, sir? What kind of diagnosis we are taking this for?
Here, to detect thyroid disorders,
Okay.
kidney disorders,
Okay.
bone problems,
Okay.
heart, blood circulation to the heart, brain disorders, and liver disorders. Many organs we can study. Lung problems, especially pulmonary embolism, etc. Those things we can detect.
Okay.
With gamma camera.
Okay, sir. How is it possible to show how it is working, sir? What is the movement of this machine? See, patient is here, then what is the next step? What, how it is moved?
From there,
Okay.
you go and
It's after, see, I don't patient, could you please explain that?
you can tell in Malayalam, no problem.
Okay.
Procedure, it is like patient will be lying down here.
Okay.
These both are our detectors.
Okay.
So from the patient body, gamma rays will be coming out.
Okay.
It will be detected by our
Okay.
two detectors. It will be detected.
Okay.
It will be moving round the patient actually.
360 degree, it will move.
Oh, yes, yes, yeah.
So in any angle we can check the
Ah,
patient and get the images.
okay, understood. Yeah, yeah, yeah. So,
Not like a radiology department. From the machine there is no radiation actually. From the patient body radiation will be coming out.
okay.
That will be captured by our camera.
That means patient will be up to here, it will move.
It will go up to end.
Okay,
it will
then, okay.
Whole body,
Whole body it will
you
move.
can screen at a time.
Okay. Yeah. Yes. Yes. Okay, fine.
come up to here.
Up to here.
Patient head is here.
Yeah.
It will come up to here.
Okay.
From the toe to head,
Head we
entire
can
body will be covered.
recover.
You can scan whole body at a time.
Okay.
From front and from back, both.
Okay. Okay, sir. മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡിൽ കാസർഗോഡ് ഡിവിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിച്ച മാംഗ്ലൂർ AJ ഹോസ്പിറ്റൽ ആൻഡ് റിസർച്ച് സെൻറ്ററിലെ ന്യൂക്ലിയർ മെഡിസിൻ ഡിപ്പാർട്ട്മെൻറ്റിലെ ഡോക്ടർ രാധാ മോഹൻ കാസർഗോഡ് ഡിവിഷൻ്റെ നന്ദി അറിയിക്കുന്നു. ഒപ്പം എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു സർ.
Thank you very much.